Pretty excited because on the 15th we always welcome Mayo Clinic, but we all know that heart disease can cause serious health issues, but it can be even worse for you if you're pregnant unless you're monitored properly. Mayo Clinic cardiologist Dr. Tasmin Naqvi is here with us with some information, really important information that you need to know if you're pregnant or thinking about getting pregnant, especially if you have a heart history. Welcome, Dr. Naqvi.
Good morning.
I'm so happy to have you here. Boy, we have had really quite the conversation this morning. I've already learned so much from you, and I know our viewers at home are always interested in being heart healthy, but what are some of the risks that pregnant women have with heart disease?
So pregnancy is a very unique condition, and women have remarkable bodies that are able to adapt to this miracle, I should say.
Right.
But at the same time, these adaptations require us to have a healthy heart and healthy blood vessels. And if we don't have those, for example, if one is born with congenital heart disease and has had surgery for it, or has uncorrected valve or heart surgery, then we are at higher risk because the heart is under pressure. It has to work harder,
right,
50% harder than in the non-pregnant state.
And that is because of the pregnancy. But how does the pregnancy affect the heart then?
So the pregnancy produces a burden on the heart. Heart has to pump 50% higher.
Okay.
So if you have valve disease, or if you have weak heart function, that can become manifest for the first time during pregnancy.
What are we looking at here? I mean, that's clearly an ultrasound to the left. What is different about the ultrasound on the right?
So actually this belongs to the same person. What you see on the left-hand side is a valve that's narrowed.
Ooh.
And what you see on the right-hand side is the turbulent blood flow across that valve. And the pregnancy does not tolerate very well tightening of the heart valves, because that means that the heart can pump less blood, and as you know, the fetus is dependent on the mother for that extra blood.
Right, right. What should women do who maybe are thinking about getting pregnant and in order to prepare their bodies better, especially if they have a heart history or maybe already have a heart condition?
So it's very, very important for these kind of women who either have some risk factor, let's say they're obese, or they have a history of high blood pressure, or they have a family history related to heart condition, or they themselves have had heart condition, even surgery, that they consult with their doctor before they get pregnant. It's essential that they do that, because the first 6 months, the first 6 weeks of pregnancy is where all the organs develop, a very important period. So you want to make sure that period is as healthy for your baby as possible. Definitely no smoking, alcohol, or illegal drugs, because that can affect your baby in ways that the baby may have to suffer for the rest of its life.
Right, whether you have a heart condition or not.
Absolutely, absolutely,
I mean, really.
absolutely.
Yeah.
And then if you have high blood pressure or high blood sugar, seek help.
Yes.
Consult with your doctor before you get pregnant. And healthy, large babies are not necessarily healthy babies. That may actually indicate a problem.
Yeah. Now, so women who maybe are watching now and say, geez, I have some history in my family, or I even have a condition, they shouldn't be afraid to be pregnant. It's just being monitored properly by the right doctor.
Absolutely. There are very few heart conditions where we recommend that the women do not get pregnant. Those are really very few.
Okay.
Most of the conditions can work with pregnancy.
Okay.
And so some of them are actually low risk, some of them are intermediate risk, and some of them are high risk. As long as you are taken care of by a center that has expertise in this area, most of the pregnant women will actually do very well and will have healthy babies.
Well, that is good to know. Also good to be prepared as well. Dr. Naqvi, thank you so much for joining us today. We appreciate you, and just want to let you know that if you need an evaluation with a Mayo Clinic cardiologist, this is the number that you can call, 480-301-8200. And don't forget, ABC 15 is teaming up with Mayo Clinic for the Rally for Red campaign. Each month, we will give you easy-to-follow recipes and ideas to help keep you and your loved one's heart healthy. To learn more, get our Rally for Red reminders. Just sign up at abc15.com/rallyforred.